time by the pool can mean great fun for the whole family. What happens when the fun turns too frightening? While pool time can be as dangerous as it is fun, especially for infants and small children who lack the cognitive ability to discern the dangers of water. TGMC would like to discuss infant and child CPR, as well as tips on how to stay safe by the pool this summer.
All right, joining me now, Dr. Jonathon Allen with Terrebonne General Medical Center. And first of all, Doc, thank you so much for being here. We appreciate it.
Oh, thanks for having me.
All right, it's always good to see you. And I guess the first step in pool safety, a lot of people around the pools this summer. What would be the first advice you would give, the first steps in pool safety?
I think the most important thing is close supervision, that everybody's there to have a good time, the kids, the parents, and the parents just have to keep in mind, their priority should be watching the kids. You got to know where they are all the time. If you're near a pool, make sure you got even closer eyes on them than if you're somewhere else. If a kid disappears and you don't see them, check the pool first, because that's probably the most dangerous situation they can get into if you're around water, or even ponds or lakes or things like that. I know a lot of people have camps. Check the water first, and then look other places.
Now, are those general supervision tips for the pool? Are there other things that they can do to make sure that they keep their child out of harm's way?
There's a lot of things to keep in mind, and a lot of times we forget about it or take it for granted, but make sure if the kids are in the water that there's somebody, an adult with them, supervising them. If it's a little bit older child, maybe you don't need to be in the pool, but for younger children, toddlers, infants, you definitely want to be within an arm's reach of that child, just in case things happen. A lot of people like to put floaties on the kids, and they feel like, well, I could just ignore them, I can just let them go, they're going to be okay. But a lot of times those will lose air, or kids in a tube. Just frightens me to death to see little kids in a tube. Mm-hmm. It's so easy for them to reach or do something and flip over, and once they're underwater, they can't call for help. You don't know. You could be turned around by the time you turn around and realize they're flipped upside down. It may be too late. So just always kind of be aware of that kind of thing. And for the parents too, there's so much going on. People are getting together, they're having a good time. Mm-hmm. There may be alcohol involved, you may be talking on the phone, catching up with people, but again, your priority has to be watching those kids, know where they are, know what they're doing, and just keep a close eye on them all the time.
You make a good point that leads me to the next question. When a child gets a false sense of security, or the parent gets that same false sense of security, and you put floaties on them, how do you prevent the child from getting in the pool without permission and at the appropriate time? Are there things you have to do?
I think from a very early age, and I've done this with my own children, is just get them used to the water, but set rules. Let them know they shouldn't be near the pool or in the water at all without an adult with them at all times. And I mean, I'm strict with my kids because we are around the water a lot. We're in the boat, we're at the camp, we're at people's houses, and I mean, I would hate for anything to happen to anybody's kid, but especially my own. And I'm just very, very strict with them about not even getting near the pool without me right there with them.
So a lot of it's just being really cognizant of where you are, and always don't take your eye off the ball, so to speak.
Absolutely.
All right. The best steps to prepare for a poolside emergency, if one were to arise, what would they be?
The things to prepare to prevent emergencies really is, if you're a pool owner, make sure that your pool areas are locked. Make sure that you have an adequate fence around the entire pool and that's locked at all times. Making it high enough that small children can't undo the lock or they can't climb over. And that means, avoiding any kind of poolside furniture or things that the children can climb on to get over the fence. If toys or things they want are in the pool area, the children are naturally going to want to get in there. So try to avoid any kind of temptations that would make the children want to get in there, in addition. Some other things you want to keep in mind is maybe keep life jackets or like a floating throw ring or a shepherd's crook or something. Keep that kind of equipment around the pool. So if there is some kind of incident where someone falls in the pool, you'll have the equipment to deal with that situation. And just thinking ahead are some of the keys to prevention, and swim lessons, I couldn't emphasize it enough. I know American Academy of Pediatrics just last year recommended that swim lessons from children above the age of 1 prevent, drownings and accidents like that. And that's big news, because prior to that they were saying kids 4 and up should get swim lessons, and now they've said no, children 1 year old and up should now be getting swim lessons. And it doesn't mean that under 1 you shouldn't be going through those rules with the kids and introducing them to the water in a safe way, but their recommendation is definitely they're definitely preventing injuries in water by swim lessons after the age of 1.
All right, what I want to do, we're going to take a break, but administering CPR to an infant or child is very important. We're going to take a break here from Terrebonne General Medical Center. When we come back, more with Dr. Jonathon Allen, a very important subject because of the summer and the kids' use of the pool and around beaches and water. So don't go away. We'll be right back.
Together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
All right, welcome back to Your Health with Terrebonne General Medical Center. I'm Martin Folse, and we're with Dr. Jonathon Allen. There he is right there. We're talking about pool safety. And he is well instructed, well versed, has all the criteria to go with it. Not only is he in the emergency room, but he really specializes in the pool expertise with your children around water for the summer. So listen very carefully. Doc, let's go to CPR. I guess how to administer CPR to an infant or a child is important, but I guess CPR in general too, right?
Absolutely. CPR, I think, is very important. Anybody who's going to be a parent, a pool owner, a guardian, a caretaker for children should definitely know CPR, and I would strongly encourage them not just to go by the tips that we offer, the guidelines for CPR, but definitely enroll into a CPR course and do it hands-on, because you can definitely do harm trying to do CPR, meaning well, but it's important to get those techniques down. The breathing, the chest compressions are skills that need to be, taught and practiced, and it's not something to just, go into lightly.
Now you have 4 steps that we're going to look at right here, and why don't you take us through them and explain to us what they're all about.
Well, the first step is when you first find a child that's, doesn't appear to be responding or not breathing appropriately, you want to, shout the child's name, try to arouse them. I like to actually tap them on the bottom of the feet, and you can really, tap them pretty hard without worrying about any kind of injury, but enough to try to get a response. If you're not getting a response from that, you want to try to position them on their back and think about starting CPR at that point. The second step you want to go into is to do 30 compressions, and the chest compressions you want to do roughly about 100 per minute, but you're only going to do 30 at a time, and you want to use 2 or 3 fingers in the center of the chest below the nipples. You want to press down about 1/3 the depth of the chest, which for small children is probably about 1 to 1.5 inches. For a bigger child, you may want to use the heel of your hand and get a better compression that way. The next step after that is to open the airway. You want to lift the chin. You want to try to tilt the head backward gently, and you don't want to put it too far back, but just enough where you can try to keep that airway open. And then you want to give 2 breaths. With a baby, you can cover the mouth and the nose. With bigger children, you may want to pinch the nose and just cover the mouth completely and give 2 full breaths. Each breath should be about 1 second long, and you should make sure that you're seeing the child's chest rise with the breaths to make sure that air is getting in adequately.
I guess this would be an obvious question as a caveat to what we're talking about. An adult and a child, 2 different levels of compression, I would take it?
Yes.
Okay.
With a child, the chest is more pliable, the bones aren't fully calcified like in an adult, so they're more flexible. You don't have to push as hard, plus you don't have to try to push as deep because the depth of the chest is just not that deep anyway. So you get a better compression without pressing nearly as hard.
Yeah, so don't go too hard with the child.
Absolutely.
In other words, okay, that's very, very good information. If someone wants to learn more about pool safety, or they want to enroll in a CPR class, can they do it?
Yes. The best way is probably to reach Terrebonne General's Outreach Center at 985-858-7020, or they can contact TGMC online at www.tgmc.com and learn more about CPR classes and how to enroll.
Let's talk a little bit about submersion injuries also. You hear about it sometimes, not quite sure what it is, but first of all, what is it and how do you prevent it?
Well, the submersion injury is kind of just a broad spectrum of everything that can happen in water injuries, whether someone is underwater for a prolonged period or whether it's just for a short, brief period. But anything that involves being submerged completely in the water and any injuries that might result from that are considered submersion injuries.
Now, stat-wise, I think you brought some very valuable stats. Just to give people an overview of what we're talking about here, can you give us some general stats about what you're talking about?
Sure. In the U.S., drowning is the 10th leading cause of accidental death overall for all ages. But for ages 1 through 4, it's actually the number 1 cause of death, and it's the number 2 cause of all pediatric death. So it's very significant, especially in the younger age groups. And 26% of drowning fatalities are in children younger than 5 years old. So, really alarming statistics in a pediatric population. And as far as the drowning fatalities go, 50% normally occur around swimming pools, 20% are boating related, and about 15% in bathtubs. That's, almost all the drowning related accidents are all completely preventable. So I think this is why this is very important to get this information out and have people cognizant of the dangers and how common it really is, and it's so easy to be prevented.
Yeah, it's sort of unusual. Maybe it's not unusual, but for a emergency room doctor, you sort of went and got specialties in this. Did you see a need for it in this area?
Absolutely. I think everywhere there is, but particularly in our community where water is everywhere. You drive down the road, there's water. It's so easy for kids to be fishing and slip off the bank into the water. A lot of people enjoy boating, or like I said earlier, they had camps and things like that. It's always important to keep an eye on the kids first, and then if you're going to be doing those activities, make sure you have the right flotation devices, the right size, the right type for whatever activity that you're doing. And the other key thing is just try to avoid alcohol in those types of situations. It just makes everybody more cognizant of what's going on and allows you to take better care and observation of the children in that situation.
I want to take this time to also commend you. I had the chance to see you in operation in the emergency room at Terrebonne General Medical Center, and to you as well as the people around you. I thought the bedside manner was fantastic, and I think you worked really hard at being a good open doctor about that. So just wanted to pass that on to you.
Thank you. I appreciate it. I have a good team. They make me look good.
All right. Well, I think you also help make them look good too. So it works both ways. All right. Once again, Dr. Jonathon Allen with Terrebonne General Medical Center. We're going to take a break. When we come back, more on Bayou Time. Don't go away.